Okay. Hey, everybody. Happy Friday. It's Dr. Ashley, pediatric emergency mom, and I'm here with my very good friend from college, which was just like 5 years ago,
Right, just a hot minute ago.
Dr. Karen Strickland Anderson, who is a dentist and one of my favorite people in the world. And this is part of our Conversation with Kids series. And so I'll probably have you back just to talk about like teeth and dental hygiene, period. But I wanted to loop you in on our when we talk to our kids about food
Okay.
from a dental standpoint, what that means. So, for example, I've been telling the boys, I'm always harping on them like limit the sugar, limit the sugar, limit the sugar for your health. It's one thing, but then also for your dental health. But
Sure.
you know, when they're going to school and they're picking, well, not Henry because he hates chocolate, but like if Jimmy's picking chocolate milk to have with his lunch, just like that's just sitting on his teeth all day. So just like things like that. What are things that we as parents should know and should be talking to our kids about?
Okay, so I do a lot of the Dental Health Month talks with kids at schools. And, they don't let kids bring a toothbrush to school, understandably so. But I always tell the kids, like, milk is good for you, and milk has calcium and vitamin D, and, all those things that we want for our kids. But milk is also full of sugar. And so at lunch, normally what they offer is milk, chocolate milk, white milk. And you can't brush your teeth after lunch when you eat. There's just no way to do that. So I always tell kids, like, if you pass a water fountain, drink some water, because water is going, or if you have a water bottle, they get to bring water bottles down to school. So grab your water bottle and drink some water after lunch. That is the best thing that you can do besides brushing your teeth at school, because it will rinse off all that sugar from the milk and then whatever it is that they ate for lunch. So water is the best thing that kids can do at school as far as drinking and drinking milk. And I want them to drink milk. And even though two of mine don't drink milk, they hate it. But if you can't brush your teeth, then the next best thing you can do is water. And they all have access to water now. So especially when it's so hot. So after lunch, drink some water, get to the water fountain. I mean, you can swallow it. You don't have to spit it out. I mean, you can swallow it. And that's the next best thing to brushing your teeth when you can't brush at school. And if you're at home and you drink milk and you don't need to sip on it, you need to drink a glass of milk and be done. And then either drink water or brush your teeth. But that's what I tell my kids and the kids at schools when I go and talk to them.
So we hear, in the ER all the time or in your regular practice, if your baby can't sleep at night or even toddlers, well, I put them down with a bottle.
Mm-hmm.
And it makes my
Yeah, it's
I can see you like tensing up. And so a lot of people probably don't realize that the sugar that's in the milk or the juice
and the formula too. Yeah.
the sugar that's in there is just like gasoline on a fire. It's the perfect food for the bacteria in our mouth, right?
Or yeah, and like coming through a bottle, the way that you suck on the bottle, it's just terrible for the teeth. And I understand why people do it, but the best thing to do, and what I did with mine when they were little, was I gave them their last bottle before bed, and then when they start, even when they didn't have teeth, I would get just a little wet washcloth when they just had their little tiny baby teeth and wipe those teeth before they went to bed. If you put them to bed with a bottle, milk, formula, juice is just as bad. It's just full of sugar, and so it bathes their teeth in that sugar, and they get what we call baby bottle decay. And baby bottle decay is rampant decay on the primary teeth, and I mean like on every single tooth turns black, dark brown. Some of those teeth have to be extracted. They can't be restored. And then when you're extracting primary teeth too soon, it just opens up a big Pandora's box of problems. So never, ever put a child to bed with a bottle of milk, formula, or juice. Those are things that they should not be drinking. They can have it, but then you have to brush or wipe their teeth before you put them in the bed. Like, they can't be drinking it while they fall asleep. That's just a recipe for disaster.
Yeah. And we still, like, my kids, they know the last thing before bed, right? Brush teeth, but the only thing you can put in your mouth is water.
Yep. Yep. After you brush those teeth, that's it, unless you brush your teeth again. If you have another snack right before bed, which you have boys like mine, like they want to eat all the time, you have to brush them again before you go to sleep, or you can't have the snack. So, and I put water by my kids' bed all night long. I just like them to stay hydrated, and knock on wood, we don't have any bedwetting problems. But I like them to always have something to drink, but it's always water. And I tell people too all the time, like, sports drinks like Gatorade, Powerade, those are all full of sugar. Like, they have electrolytes too, but they're all full of sugar. So in my house, we drink Powerade Zero if we're going to have a Powerade that has the sugar substitute. And we don't even drink a lot of that. My kids are mostly water drinkers. If they're sick, they can have a Sprite. They're really sick, they can have a sip of Coke. But most of the time, it's water or nothing. They're not big juice drinkers either, so that's good. I don't have that battle.
I'm personally anti-juice.
Mm-hmm.
It has essentially no nutritional value.
Yeah.
And anything you need from juice, you can get from the actual fruit or a vitamin. And it's just so much sugar.
It is.
But you brought up Powerade, and I still think one of the best commercials was that Peyton Manning, and I can't remember if it was Powerade or Gatorade, but I think it was for a Super Bowl, and the whole theme was you have to sweat it to get it. So like that's when you should be drinking it, right? If I go for a run in this heat,
you have to replenish the electrolytes. Yes. Yeah.
It's not just to
sip on because it tastes good.
Yeah.
Right.
It doesn't taste that good.
Right.
Yeah. Are your kids into now, like Jibby's been talking about this like crazy, this new drink Prime that's out?
Yeah, I've heard some things about that, but mine haven't. Our little bubble is pretty small, so they haven't had anything, but I have seen a few articles written about that, and I don't know much about it, but I know it's kind of popular among the kids these days.
Yeah, it's the newest like thing that everybody wants, and it's healthier because it has coconut water in it. Well, so I'm like, okay, I'll bite and I'll get one and I'm going to read the back and see what this is all about. And it's like maybe 10% coconut water. So then I had Jimmy drink actual coconut water, which is very good for you, but I think it tastes terrible.
Me too. I hate coconut.
You just have to like hold your nose and just right? So it's actually not that much coconut water. And then when you look at the ingredients, it's all of these things that you can't pronounce, right? So I don't know how it got to be so popular, but and it is a lower sugar option.
Right.
So that is a positive. But again, I think it still falls into the category of sweat it to get it.
Right. You just sip on that.
Yeah.
If you want to sip on something, just sip on the water. And that's true for grown-ups too. I have so many patients, I treat kids, but I treat mostly adults that have they sip on Coke all day long, or they're sipping on, I love my Diet Coke every day, but like, I'm going to drink it and then be done with it. Coffee with real milk and sugar in it. Like, that is terrible for your teeth. If you're drinking a black coffee with nothing in it, my daddy drinks black coffee all day, like, that's just going to stain your teeth. It's not going to rot them out. But if you have real milk and sugar in your coffee and you're sipping that coffee throughout the day, like, you're just asking for a mouth full of cavities. And the primary teeth, they're smaller and they decay quicker, and you just I have to fuss at Mike sometimes because he lets Elizabeth have some of his coffee. And I'm like, no, like, do not. She loves it, but don't drink. I don't want them drinking those things. And the drinks tend to be where the kids falter the most, I think, is what they're drinking, not necessarily what they're eating.
As far
That
as
causes the decay.
sleep health, sleep,
Yep.
sleep
Yep.
health, mental health.
As well. Yes.
Yeah.
Yes. So like when I have a patient come in, like a teenager, for instance, and a lot of times it's college kids who it's like their first semester at college. And, we've both been there. Your lifestyle changes and they have all these cavities and we start talking about, okay, what are you doing differently? And a lot of it with college kids, and I don't, you probably know this about me, are energy drinks. I despise an energy drink. So they're drinking these energy drinks, which have lots of caffeine and a ton of sugar, and trying to stay awake to study, or they went out the night before and they're trying to wake up for class, and their teeth are decaying because not only are harming their body, they're drinking all that sugar and it's rotting their teeth out. And you would be shocked. Well, you probably won't because you work with kids, but I talk to kids all the time at schools about good things to drink. And so many kids drink energy drinks. I'm not talking about like Powerade or Gatorade. I'm talking about like those drinks that I would never drink because my heart would beat too fast. You know what I'm saying? But most of when I trace a problem back with a patient on why all of a sudden we have all this decay, it's normally because of something they're drinking, not necessarily something they're eating, if that makes sense.
Yeah, totally. And so, and I think, I mean, if you are the person that does sip coffee throughout the day, then if you're taking a sip of coffee, like if you take a sip of water behind it, so then it's not just sitting there, right?
Right.
But you're right. You're totally right about the energy drinks. It's mind blowing. And it can cause like first of all, the talk about drinks that you can't pronounce the things that are in them. Wow.
I know.
But it can really cause palpitations, chest pain. We've had kids with myocardial events, like with cardiac events because of these.
Yeah.
And even caffeine toxicity.
Crazy.
Yeah, it's just and so I think it kind of falls in with like the prime of being the cool thing to drink, or this is
Right.
what everybody's drinking, and not thinking about the long-term effects on your teeth and your body.
Sure. And my kids are kind of programmed having both parents and a grandfather as a dentist and an aunt as a hygienist. Like there are just certain things in our household that we don't drink and we don't have. I mean, I don't even keep Diet Coke in my house because I would drink it all the time. I love it. But I also love my teeth and I don't want them to rot out either. But I think a lot of it too is parents just have a misconception about what is actually in what they're giving their kids. And it's quick and it's easy. Here's a Gatorade, it tastes good. Go drink that. It's good for you, right? It has all these electrolytes in it, but it's really not great for our dental health. And I don't think parents do it on purpose. I just don't think they know.
Yeah,
I really don't.
Yeah, no, I agree completely. And so I think that this is good for parents to know so that when they're talking to their kids, if they don't want their kids to have something and their kids, why, especially like our kids are of the age now, they're going to challenge and say why. You can come back with some objective information and say, well, for your health, for these reasons, and saying, I don't want your teeth to rot out of your head, and then you have to get a bunch of shots in your mouth.
Right.
Well, that's going to get a kid's attention.
Absolutely. Or Google. I do this at the schools too. I have big pictures on my PowerPoints. Like, this is what teeth look like that have bad decay. This black, yucky tooth. And this is what it looks like when I had to pull the tooth. So if there's a consequence for like a visual, this is what your tooth is going to look like.
Yeah.
And, I guess it's a scare tactic, but in some cases some kids may need that to actually understand why they can't have certain things.
Yeah. And so for parents that might be watching primary teeth or baby teeth, and so if you're having to pull baby teeth, like baby teeth serve a purpose. They keep the space for the permanent tooth.
Absolutely.
The baby teeth fall out when the permanent tooth starts to erupt and push the baby tooth out.
Correct.
So,
Correct.
so you're right, like such a chain of events that sets off if you're having to pull those teeth.
Oh yeah, and you're looking at, if those teeth have to be pulled, you're looking at space maintainers. You're in a whole, you have to retain the space for the permanent tooth. So you're looking, it just opens Pandora's box. The easiest thing to do is drink healthy drinks, eat healthy foods, brush your teeth twice a day, floss once a day. We do in my house, I do a fluoride rinse. We use ACT. Each kid likes a different flavor, of course. But we use an ACT rinse, but I make sure, parents, if you're doing a fluoride rinse, you have to make sure your kid can swish and spit, because if they swallow that, it can be not so good. So they have to be old enough. We didn't start that till probably 4 or so, 5 maybe. Gosh, they're almost 9 now, so that's hard to believe. But the ACT rinse is just a fluoride rinse that we do. We only do it once a day. But if you're doing all those things, then you prevent a whole realm of issues that come with tooth decay, loss of primary teeth, and so on and so forth. So because it can become a big problem. Some parents think, oh, it's a baby tooth, it doesn't matter. They're going to lose it anyway. And they are, but it needs to stay there, especially those back teeth for kids. They don't lose those teeth till they're 10, 11, 12, sometimes 13. So that tooth needs to stay there for a long time so that it can hold the space for that premolar that's coming in underneath it.
Yeah, for sure. And I just a funny story, and then I'll let you go because I know you need to get back to work. But so my kids are 10 and 8, and Karen has triplets that are 9. So 2 boys and a girl that are 9. And so before Jibby was born, I was not going to let my kids have fast food, and I was going to like make their own baby food.
Oh, it's going to be all organic, right? We're going to make it all.
And so then when Jibby's like a year and a half and the triplets are born, and Karen's still she's sticking to there's going to be no fast food, no canes, no. And I'm thinking like, oh, sister, I was there. And then like I did not make it. And then I don't know, they were like a year old or a year and a half, and you call me and you're like, I did it.
I took them to McDonald's. And now on Friday nights, I'm like, we're just going to eat canes tonight, y'all. Like, I can't, like that. I attempted it for a while. And then I was like, I can't do this. Like, I can't. Like, I made them, I would blend up avocado with coconut oil and like feed it to them like baby food. And then I was like, what? I have a job. I can't do this. Like, and kudos to anyone who does. Like,
Absolutely.
good for you. You are amazing. But for me and my family, we went to McDonald's and I was like, here's some chicken nuggets and some French fries. Go to town, because I cannot. Oh yeah, my sister makes fun of me for that all the time. I can't. Do you remember? Oh, Ashley, there is a video that my niece has, and I'm in the background. The babies are little, and Caroline's playing with Elizabeth, and I'm in the background fussing at Kay. Do you know how many calories and fat grams are in a 1 Raising Cane's box? Like, I'm fussing at Kay for letting her kids eat canes. And here I am. Hey guys, y'all want canes tonight for summer?
I mean, we do, like, the video I just did was with Ross Ford. I don't know if you know Ross, he's a chef. But we talked about healthy eating and meal prep and like how hard it is for working families, and like the tips and tricks you can do, and like getting kids involved with cooking. That's its own beast, right? And we do the best we can, and then on some nights it is just we're gonna have fast food tonight, and that's how it is. But for your part and the dental part, the fix is so easy and cheap, right? I mean, it's water, it's rinsing with water, it's brushing twice a day,
flossing once a day, using an ACT rinse if you're comfortable with a fluoride rinse, and that's pretty much it. If you do those things, you know, they taught us in school, you have to break up the plaque at least once a day. At least once a day. Twice a day is ideal, but at least once a day. If you do those things and you're not sipping on sugary drinks all day, like, you know, some people have a genetic predisposition Now that's not like research based. That's my opinion because I see parents and kids, and like it's like looking at a clone sometimes of a parent's mouth.
Mhm.
Some kids are more prone to decay than others. Normally, the kid that takes the best care of their teeth in the family always has a cavity, and the kid who does nothing, that's just Murphy's Law, right?
Yeah.
But if you're doing what you're supposed to do, drink water after lunch when you can't brush, or even if you're on vacation or you're on an airplane, or you don't have access to get your toothbrush out, just ask for some water, and that can help prevent some really bad stuff. So yeah, easy fix.
Awesome. Thank you so much, my
Oh,
friend.
you're so welcome. I hope that I helped and I was informative.
Of course you are. You always are.
Oh, you're so sweet. And if anybody ever has questions, they are welcome to call me, contact me, whatever way, and I will be glad to help in any way.
Thank you, friend. Have a good
No
rest.
energy drinks, kids. Do not drink an energy
No,
drink.
no energy drink.
Bye, Ashley. Thank you so much.
Bye. Thanks, Karen.
Okay.